So you should all have a recording in progress sign. And Leslie, over to you for the intro, if you would.
Wonderful. Okay. We are very privileged this evening to have Julie Parker with us. She has spoken to the Kansas City support group meetings a few times. And I just want to kind of go through a little bit about her background. She is an LPC and she has Counseling Associates LLC, which is her own practice. And she has been a counselor for over 25 years. And she's been, my apologies, I've got two dogs in the room. Um, and she works with individuals and families and couples and all ages. She is certified in anger management and has extensive training in helping those with chronic conditions such as Lyme. Julie has been talking with us about mental health and Lyme disease issues previously, and we are just honored to have her with us again this evening, able to discuss, all the ins and outs of what we deal with taking on a chronic illness such as this. So Julie, welcome.
Thank you. Thank you. I'll say ahead of time, I'm a little hoarse, so I'll try not to clear my throat because I know that's not fun to listen to. So just forewarning. Anyways, thank you for having me. I appreciate the invitation and I always welcome questions. So I actually do better if I tell you a little stuff and then you guys can ask things, whatever you might want to know. So I thought I would start with a little bit about what I do because there's a little difference between being a Lyme literate therapist and being a regular therapist, right? One who's not Lyme literate. There's a lot of similarities, but one of the main things that I do is educate Lyme patients too, right? Not just non-Lyme patients, but Lyme patients, because we come with questions. We are pro-level investigators, right? But we also have questions. I do a lot of explaining things, and I also help with coping skills. How do I manage my symptoms? How do I manage my family? How do I manage my doctor's appointments? Because as you know, actually the pain clinic appointment already came up a few minutes ago with somebody, and that's, we have so much to manage as Lyme patients that looks different than you would if you were a counselor for your, I say normal again, but right, anxiety, depression, those kinds of things, life issues to work through. It's all compounded when you are a Lyme patient. And to clarify, when I say Lyme, I mean Lyme plus all the other mess that comes with it, right? Like co-infections, including mold and toxicities, whether those are metals or you name it, right? So that's, to me, there's no real need to differentiate in this context. Anyway, you guys are welcome to ask about that kind of stuff, but there we go. Anyway, Lyme is all the stuff because it doesn't come by itself, right? Lyme has always got friends, unfortunately. So that said, I'll kind of lead in and then give you a little more info and let you guys kind of ask what you might want to know about Lyme and mental health and answer what I can and help us like share some info with each other. I will say that there is a common belief, you've probably heard this before, among Lyme professionals that there does not exist, there's limited existence, to be fair, of a chronic mental health condition without some sort of pathogenic cause, right? And if you've heard that before, that's great. If not, think about it, right? So if I have difficult to treat depression, there is likely an organic cause, right? There's something creating inflammation, helping to create my chronic depression. Now that doesn't mean that depression, et cetera, for example, can't occur outside of Lyme, right? We can have chronic life circumstances. We can have life skills that we need to work on that help pull us out of that. But I don't know anybody that wants to be depressed. That's the point, right? So if you've got chronic, hard to treat depression, we go looking for some sort of pathogen. And again, pathogen meaning infections or mold or other toxicities, right? So then look at other chronic mental health conditions like panic disorders, anxieties, even things as heavy as we might think of as maybe schizophrenia, hallucinations, et cetera, because those often come with Lyme. But if you pull what we know about mental health in general and look at chronic conditions, if you scratch the surface, we find reasons, not just what I would have been taught way back when I went to grad school originally, which is that there's a hormonal imbalance or there's a chemical imbalance. We ask, as you guys would, why is there an imbalance? What is that? What's causing it, if there is one? And then to look at genetic factors. So I will also say I encourage my clients to get genetic testing done if they haven't already, to look at what factors may be contributing to a mental health diagnosis. Now, that's not necessarily to go do like a 23andMe or whatever they might be, but GeneSight, you guys know about that? Have you heard of that? Yeah, a couple, yeah. So GeneSight is one company, there are others, but that test for the way you might be more likely to process a psychotropic medication, but it will also look for other genetic abnormalities that affect it. And one of the common ones in Lyme is going to be the MTHFR mutation, which you've probably heard about already, right? But that affects the way you metabolize medications and other things. So I encourage that as a part of the mental health piece. But that said, a lot of what I do is coping skills, education, etc. But I also spend a great deal of time helping people figure out what treatment fits them best and which doctor fits them best, and then how to manage buying into the treatment that you're doing. So then if you come to me and you're working through family stuff and you're doing your normal counseling stuff, you're working through a situation, you're working through whatever, on top of that load is, do I trust my doctor? Who do I trust in my life? Who do I trust for whatever else might be coming down the pike? So I do a lot of decision tree kind of things where I might say, what treatment do you think you like? Why is that? And who will help support you in this? And that's emotionally, sometimes financially, but it's emotionally, mentally. What do you need from me? And then what do you need from your other providers so that we can find you the right team? And then I am always willing to work with your Lyme literate providers, especially because I often get a different clinical picture than even your Lyme doctor does, or Lyme doctor, again, thinking there as in full practitioners, whether that's naturopathic, integrative, just Lyme doc is my term for that. But happy to always work with your Lyme docs, because when you come to me for an hour, whether that's an hour session once a week or once a month, it's often more frequent than you're going to see your Lyme doctor. So I get a different clinical picture of what's going on with you. And then anytime I would do that, obviously with permission, but to help your doctor know, or help you know, really, even then, what to tell your doctor about what's working and what's not working, because I get a more real-time picture of your symptoms. Does that make sense? Yeah. So, that said, I kind of have, I would sort of a pet peeve, and I want to address that real quick, and then open the floor. Because again, I'm not a fabulous speaker. Don't even pretend to be. Let's talk about what I can do to help you, what questions you might have. But of late, I have seen a tremendous amount of content online, name your platform, wherein well-meaning providers in the Lyme community are saying that you must heal your emotions and or your nervous system before you can get well. I wholeheartedly believe that is not true. So, coming from a mental health professional who wants you to calm your nervous system, who wants you to heal emotionally, that might sound strange. But what I know is my biggest issue really with this is that if I am calming myself as much as possible and I'm learning the skills and I'm working through the issues and I'm advocating for myself, but there are things in my body that are hijacking that nervous system, then to tell me that I have to heal my nervous system first is in a well, not even so roundabout way, blaming me for me being sick. So if you're working with somebody who says you must heal your nervous system before you can get well, ask a lot of questions. What does that mean? What is that going to look like? What do you mean heal my nervous system? What do you mean heal my emotions? Because it's also been my experience that often our emotions heal last. Of course, that's a good reason for me to say you need a Lyme literate counselor, right? But to help you through that along the way. Because what I'm not saying is that regulation is impossible. I'm saying to consider that both things may need to, or all the things may need to happen at once, but to be wary of this online space where personal and professional pet peeve is that there's a growing wave of you must heal that first, and that's not fair. So there's my little shtick, if you will, and I would love to know how I can help you guys, what kinds of questions you have about mental health and Lyme, and what seems interesting or confusing or any of those things. How can I help?
Well, I have a question. Are you familiar with the term anhedonia, feeling no joy?
Yes.
So that's something, I read a lot about, and it seems like most people that suffer from that blame it on taking like antidepressive drugs or something, but I've never taken anything like that. And I'm just wondering if that could be related to Lyme. I mean, it took me 10 years to get diagnosed with chronic Lyme, and I've probably had it 15 plus years, and I've kind of had the same thing, just kind of feeling numb all the time. I mean, I enjoy being out with people and doing things, but just don't feel anything basically. And the only word I could find to describe that was anhedonia. So is this a Lyme thing, or is it, something else? Or I mean, I don't feel, I know there's two different types they talk about anhedonia, and I don't think I'm depressed, but I just have this, like I said, feeling no joy type of thing. So
Really possible that it's a Lyme thing. There are a couple of other possibilities. You mentioned medications. It may not just be psychotropic medications. There are others that will have an effect on our ability to feel emotions deeply. And so trauma can do that to us, but then we get into
yeah,
the
that
weeds. Go ahead.
I was gonna say that's when this all started. We went through a lot of different struggles, and then the lack of sleep thing, and a lot of people talk about, and then that's when all the Lyme symptoms kind of kicked in. So that was my other thing too, is maybe it is just dealing with all this past trauma and stuff too. I mean, I was watching some doctor show on TV a while back, and he was talking about people's feelings, and he said sometimes you just have to build a wall and shelter in place, kind of protecting yourself. And I thought maybe that's part of this too, but I was just curious if it could be related to the Lyme thing at all, or if it's something else. So
Yeah, I think sometimes it's difficult to discern which is the biggest culprit. So sorry, because you described a perfect storm, right?
mhm.
Trauma and illness and the need to protect yourself then kicks in. But we also know that Lyme often on a SPECT scan or other brain scans, it will look like a traumatic brain injury. So then you've got the compounding of how much is my brain processing and how much are the correct signals are getting to my glands even to help me kick up an emotion and get things going. And what you may be describing is a mild depersonalization, sort of derealization. I don't know if you're familiar with those terms, but
Mhm.
it's a scary sounding thing when I say it's a form of dissociation, but it's not meant to be. You don't have multiple personalities, right?
Right,
But
yeah.
we dissociate when we back away from emotion or we back away from an experience, sort of. And with Lyme / trauma / whatever else might be going on, sometimes we become overwhelmed and we just sort of stop connecting to the world. And with the depersonalization, what I've described when I hear, or a good way to describe it is when you feel that numbness, I can't get excited, because you may not also be very sad, because you said numb, right?
Right.
Is as
Yep.
if there were formerly an imaginary string connected from your heart for emotions. And we're going to run it down your arm and out into the world. And it's connected to a thing that might have sentimental value, or an experience that you remember, or a person. And when the right factors are in place, again, Lyme plus things, the string is cut sometimes. So then you can look at the thing or the experience and think, I remember that's supposed to feel some way, but I don't feel it. It can be repaired again with treatment, whether that's medication, supplements, therapy, the combination. But I like the string analogy, because actually I had an example of a client, long ago client, who went to, I just want to be triggering. He went to a funeral, and he was like, huh, I think I'm supposed to be sad. This is a family member. Everybody else is crying
Um,
and I don't feel
yeah,
anything.
yeah.
And he couldn't make it happen. And then after the funeral, he disappeared and changed clothes from a suit to jeans and a t-shirt and came back to join everybody. And his spouse was horrified. How could you do that? And he's like, well, I don't know. It's over. What's the problem? So he even could not connect to the emotion that might be in the room. It's not even just social cues. He was like, well, we're done. And then he's
Mhm.
processing it with me and going, I remember this is supposed, everybody else feels it, but I don't feel it. Yeah.
So do you do virtual sessions like to people in Minnesota, or I mean, my wife and I have been working with a therapist monthly for probably over a year with my health issues, hers, but she's not really, Lyme literate and doesn't really know how to deal with the anhedonia thing either. So do you do virtual type meetings for out of state people, or?
I do. So if you're in Michigan, oddly enough, Tennessee and Mississippi, I do officially do counseling, do therapy. In other states, I do coaching, which essentially amounts to the same thing. We just have to be careful not to blur too many lines legally, right?
Okay, okay,
But yes, I can work with people in all states, because so much of what I do is what I just did right now, which is an education piece, right?
yeah.
I explained it and you went, oh, I saw you start nodding your head, right? Like, oh yeah, that makes sense.
I'd like to talk with you more. So are you going to give out kind of your contact information at the end or something then, or?
One of our stewards and one of our elders are teachers.
So we can do that for sure. Yeah,
Okay, I don't
go
want to
ahead.
take up any more of your time, but I wondered too if it was more trauma. I'm really not taking any prescriptions. I've been taking some, I don't know if you're familiar with, what's his name?
Dr. Rawl.
Dr. Rawls. He's a Lyme doctor and he has his own line of supplements. I give him credit for probably fixing 80% of my symptoms, but it's just a struggle with this anhedonia thing and energy and stuff. So, but I don't want to take up everybody's time, but maybe at some point we can connect or something.
Absolutely. Yeah. So you can find me online at lymetherapist.com. That's probably the
Okay,
easiest way to look me up. There is a schedule you can access there, but right now it's mostly blocked off, because the phone number there actually links to my private practice, where I do mostly about half and half in-person stuff.
okay,
But the phone number goes to my administrative staff and they can help with whatever, but lymetherapist.com, easiest way to
okay.
find me.
All right. You've been a big help already. Thank you.
Oh, thank you. Yeah, and besides that, I always tell Judy I'm not a huge speaker, but I'm thrilled to answer questions and do what I can to help.
Okay.
No. What do you guys find is your biggest mental health struggle? That's a big, ugly question. You don't have to answer it personally. You can answer in maybe vague terms because we know we're not doing group therapy. But I will say before anybody, if anybody wants to answer, that people will tell me that pain is awful. Pain is miserable. We are patients at my house as well. But the pain plus the emotional dysregulation plus the stress of being sick is the worst combo. And I would welcome your thoughts on that.
To me, it's family and friends and everybody else not understanding what you're going through with chronic Lyme. They look at you and tell you, you look fine. And, I even had a cousin who was more like a brother to me, and I was having a bad day, and he told me to stop being like a baby. It's like people just don't have a clue. It's just that's a really hard part for me.
The isolation essentially then, right? Lack of support.
Yeah.
Yeah. Yeah.
I used to have really terrible anxiety. But after, being treated, that has subsided a lot. And just talking, to someone that like you're having a panic attack. I think if you know that's what's going on, then you don't, it's easier to handle. Okay, just take some breaths. And so
Yeah. Go ahead. I'm sorry.
not really a question, just a comment.
No, I appreciate that. In fact, I have a little bit different take sometimes on managing panic and anxiety in general because, and some of you may have heard this from other people, but when you start to have anxiety and panic, our first impulse usually is, oh, I have to stop that, right? We really need to do the opposite, which is recognize it and allow it to flow over us, because when I feel it coming on and start sending the signal brain to body, we're in trouble, we actually get a renewed adrenaline rush and can make it worse. Again, it's not your fault because that's our nature. I must make it stop. But you're telling your body that you're in danger versus going, well, this is really crappy. I got to ride it out, because that's not our natural proclivity. Our natural proclivity is to run, get away, right? Make it stop. Or to sit down and be still, because if I'm still, maybe it will go away. But realistically, movement is the best thing. And if you can move around. And
I always say, change the channel.
Absolutely. Yeah. Yeah. Distraction and movement and acknowledging it are huge for managing anxiety and panic. Because I used to have a thing on my old Facebook page that said that never in the history of calming down did anybody ever calm down by being told to calm down, because it doesn't work. Count to 10. I've counted to 10 ways that I'm going to freak out now. Right. That doesn't work really either. Take a deep breath. That's a good idea, but that's hard to do when I'm
Back the two together, add some strength. And then it's got those metal bars below it.
Oh.
Zip tying on the metal bars. That's great.
so.
Is it similar to PTSD, which is what our military has when they come home?
What do you mean? Clarify.
A lot of the guys who've been overseas and have been in really traumatic situations, they come home with serious PTSD. And I'm wondering if this is similar.
Experiencing Lyme or the panic? It's very similar. Go ahead. You're breaking up. Sorry.
I don't know. There's something wrong with my whole immune system. I don't even recognize it. I guess it made changes. So I don't think anything's working right.
We can hear you now. Yeah. But
Okay.
just me. Could have been just me.
I'm just wondering if it's similar, because when I was diagnosed with Lyme disease about 20 years ago, I was told that things like norepinephrine and serotonin and all those levels were very low in my body. So I'm just wondering how much that affects us. Probably a lot.
A tremendous amount. Yeah. So I make very few blanket statements, but one of them is that Lyme patients, by the time we have a diagnosis, have a form at least of some medical PTSD. Right, so we actually have that from what we've been through to get to the diagnosis, but also the chronic inflammation, which usually has hit our brains by that point, because it happens fairly quickly, creates what looks like a traumatic brain injury. And PTSD and TBI and Lyme are very similar in brain scans with the way our brains begin to fire, et cetera. So, add inflammation, add an infection that's disrupting signals, add then a body that can't regulate itself well, and it looks very much like PTSD. So then looks like quacks like might be, right?
I several years ago, quite a few years ago now, I heard Dr. Amen. Are you familiar with him?
Yeah.
He specializes in the brain, and he has a lot of information on how the brain is affected by Lyme disease. And apparently he's done a lot of research on it.
He actually has at least one Lyme literate doctor on staff. And I am nerdy about that stuff and find it entertaining to go look at the SPECT scans, the brain scans they've done, where you can see the lack of oxygen to certain areas of the brain or lack of firing in certain areas. I really respect his research. And Dr. Ebony Cornish is one of his physicians. She works with them, and she comes to the Lyme conferences and actually does a lot of speaking about that very thing, Lyme and the brain and PTSD and mental health.
The reason I brought this up is I know a lot of the military guys are now doing psychedelics.
Mm-hmm.
I'm wondering if that would be at all helpful, because they're finding that sometimes one treatment, psychedelic treatment, makes all the difference in the world. And you can see it on the brain scans.
Yeah, it can. My only caution is to always do it under the supervision of somebody who really knows what they're doing and who understands Lyme, right? Obviously, yeah. Because actually I'm all for certain of those treatments, because my stance is if it works, it's not my place to question, right? Like if it works and you feel better and you're good, then that is fabulous. Hopefully there's research about it. But even if there's not, if it works, it works. Yeah, ketamine is pretty frequently used now with Lyme patients. And I've even known Lyme patients to use mushrooms, etc. But the trick, I think, is that some of those things, because they're psychedelics, can actually trip us into something, and that's just the caution, but that's with anything really.
I understand that you can't do it here in the United States. You have to go to Mexico and it has to be done in a clinic.
So it might be a specific treatment you're talking about, but I know ketamine's widely available in the US. And are a couple others, psilocybins, those kind of things are fairly widely available here. But you may be talking about something different that I don't know about.
I think that's the one that the veterans are using when they come back.
I don't know. Do you guys?
They go to Mexico to do it in a clinic setting, not by themselves.
Right. I don't know what specific thing you're mentioning for sure, but again, I'm all for what works. Use caution.
This particular one, they've done studies at Stanford on how effective it is. And I find it fascinating because, you hear psychedelics and you go, oh, no. But a lot of them are saying it's just made a world of difference for them So I'm just throwing it out there as an interesting bit of knowledge that might be helpful. I don't know.
Hi there. My name is Jason Simmons. I'm from Kansas City, Kansas. Grew up with Lyme disease back in 1990, and has since been symptom-free for many years now. But I think you might be onto something because the spirochete gets into the tissue of the brain, and in your spinal column, and there's not much else that can get to those same places. And I think the cyclosilin, I'm not sure if that's pronounced correctly, with the mushrooms, they became legal in Colorado, I believe. But I think you might be onto something there.
What I'm speaking of is, I'm not sure if I'm saying it right, but it's ibogaine, and they're using it a lot with our military guys because they come home and they're so messed up. A lot of them take their own lives, and this has been a godsend for them, apparently. So,
Sorry, I think that, yeah, it's super interesting. And I'm for what works and under supervision if possible, deciding what works for you is what's going to be best.
plant-based medicine, not a drug per se.
Right.
It's a drug that comes out of a plant, God's natural medicine, and apparently makes a huge difference.
I will say there are medications that will cross the blood-brain barrier that will help kill the germs and or detox the body. There are some options that work to do that. And add to the picture with veterans, and that is that there's concern that many who come from the Middle East will come back with a Bartonella infection from sand flea bites.
Wow.
And so compounding trauma is the possibility of infection gained while on a deployment.
Wow. Yeah, back in 1990, there wasn't an accurate test. So my dad went under a spinal tap in Cape Girardeau when the fault was predicted to have an earthquake. In fact, they were talking about what would happen while the spinal tap is in your spine if we heard the earthquake happen. Like, don't talk about that. I can't move. But yeah, the blood tests back then were not accurate at the time. And that was the only test that he was able to come up positive and find the spirochete in his spinal fluid.
Wow.
I will say, I know two people that got a great deal of help with crushing depression with ketamine. So the psychedelics have been helpful. Also on a personal note, I had a great deal of work with EMDR, and I found that really helpful. Surprising. That was back before we knew I had Lyme. And just as background, I had really bad depression for 45 years until I got treated with Lyme in 2020. And so I've been pretty much okay on the depression front for the last couple of years, but seemingly that looks like Lyme was doing that. And
yeah, go ahead. Sorry.
there's also a comment about low norepinephrine, low codecalamine levels, and it's kind of curious. There's a condition where the body will stop converting tryptophan into 5-HTP, and it's triggered by inflammation. They don't know the exact mechanisms. And personally, I think that's why 90% of the people who are depressed because they're just not converting tryptophan. And I'm not an MD, so take that for what it's worth. But and that's caused by inflammation, which is definitely a Lyme, Bartonella, babesia thing. So yeah, cause a lot of psych issues.
Yeah, and common literature, if you will, mainstream literature is recognizing the number one, the value of supplements, thank goodness, but number two, that there's such a close relationship with inflammation and mood. And that it's huge. You can't say there's a one-to-one relationship, but it's awfully close, right? When you get that inflammation down, then mood improves, thought processes improve, brain fog begins to lift, etc. The catch is just what's causing the inflammation. And 5-HTP is actually also a great supplement if you can get your body to absorb it.
I found it to be so.
Yeah.
Do you see any statistical work being done in mainstream medicine to look at how many psych disorders may be related to Lyme? I mean, you see anybody trying to get numbers, trying to do the kind of stuff that we need to have so we can get it to be recognized by the mainstream community?
Yes, or yes, but. So Dr. Robert Bransfield, Bob Bransfield, has been a long time been a leader in mental health and Lyme. He's a Lyme literate psychiatrist in New Jersey. I believe that's right. And he's done extensive research. He's done multiple articles. There are other authors you can pull up that talk about chronic mental health conditions and Lyme. And what we need is for mainstream medicine to read what's already out there, right? It would be great if we could get more studies. I'm always on board for that, right? More studies, let's look at that. But you have to get these same people to acknowledge Lyme in order to pull the Lyme patients in and look at the statistics of what happens when they get better, right? That's a little convoluted. Does that make sense? There's a lot of there's studies out there that talk about mental health, mental illness, and Lyme, and getting your psychiatrist next door to read it is a bigger problem, realistically. But yeah, I don't know of any ongoing studies that are specifically watching that, but that doesn't really mean anything because there could be any number of action happening that I don't know about. So I'm hoping. I do know that Doctors Bransfield, sorry, and Rosalie Greenberg, she's a psychiatrist also out on the East Coast. She does a good bit of presentations and some research articles. So those are people to look up and watch what they're doing. And I know that Dr. Cornish, actually with the Amen Clinics, is on board with research about mental health and Lyme. But large scale studies would be fantastic to just launch it out there then to the general public. Hey, this is a thing, right?
Yeah.
Yeah.
Can you please put those doctors in the chat
Yeah.
that you just mentioned?
I will do it right now. How about that? Bransfield, Greenberg, and so that you can be able maybe look those up. They're not the only ones. They're the ones that come to mind right away. There's some good stuff happening out there. I find the bigger problem really is, I sound a little snarky about it. I didn't mean it to be that way, but it really is to get the people that are already practicing to read what we have. And as you know, you can go to any number of providers who still don't get it. I have trouble getting therapists to even realistically understand that a huge chunk of their clients may have chronic infections. Their newer therapists are now being taught that there is a stronger link between mental health and the physical body, but it's still a whole lot of, you get sick, you might get depressed, because who wouldn't, right? And then pain and depression are linked, but the true understanding that an infection or a toxicity can be the cause or the primary cause is still difficult to get people on board with.
Question.
Yeah.
So how accurate do you feel the tests for neurotransmitters are?
Meaning if you're looking for what specific things like serotonin, endorphin levels, that kind of stuff?
Yeah, I just took a test. It was a urine test and it was to check neurotransmitters. And I thought the only way you could really tell what was in the brain was an autopsy. I mean, I know the gut makes a lot of the transmitters. So are you familiar with any testing of
I'm
neurotransmitters?
familiar. I don't want to speak like I'm an expert on the testing in particular.
Uh-huh.
My caution usually is just that neurotransmitters or any chemical in the urine may or may not reflect what's happening in my brain.
Okay,
Right? So if
right.
it's testing and it's giving you a result, I think that's fabulous. What's really going to matter is what's your brain doing with it, what's your body doing with it ultimately. Because I mean, you look at meds like SSRIs, selective serotonin reuptake inhibitors, most common antidepressant out there are those kinds. But what we don't really know is how to measure your serotonin uptake.
Well, also, I didn't think there was any research on the use of long-term antidepressants within a patient. I mean, how it affects the body, the receptors within the brain. Is there long-term research?
There is longer term research on how we, I don't want to speak out of turn, but how we manage with or without medications, but the debate is cause and effect, right? And that's difficult to prove. I do know of some studies ongoing right now, one in particular where they're studying the different effects of medication on male and female mice and what the induced psychosis looks like with or without certain medications. But those are such controlled studies, right? So then in humans, we have so many confounding factors that it's difficult to parse out what's one and what's the other, because then add the fact that if I've got chronic Lyme and you take me off my antidepressant and I'm depressed again, you still maybe haven't treated the cause. I don't know if that answers the question as much as maybe, but it's difficult to track, I think.
You know, I think one component we haven't addressed in mental health, I think dietary issues are extremely important. You know, talking about inflammation within the body, within the brain. You know, I mean, I've known forever sugar is inflammatory. You know, our diet, our Western diet is just crap, actually. So, you know, I kind of did this little thing for the past month. I've been off all sugar, all processed food. And I do feel better. I feel like my body is, you know, responding in a positive manner. I went for a dental cleaning and the dental hygienist said, "Oh my gosh, you know, I can tell in your mouth, you know, inflammation is down. I can tell." So I think, you know, we're always looking for a drug or something like an easy answer. But, you know, I think an easier answer might be what we're putting into our mouths. You know, having water, you know, purified water, grass-fed meat, organic foods. I think that's a big part of the picture. I just don't think that, you know, after, you know, dealing with Lyme for so long, I'm thinking, okay, I've got to do something different here. So.
Yeah, I absolutely agree. The diet's a huge factor. I think we could probably all agree. The problem is managing it, right? It's harder. And I applaud you for getting off sugar because that's difficult for a lot of us. Sugar is an addiction, essentially. I'm not real careful. I mean, we crave it. And possibly our body begins to crave it to feed the germs, right?
Right. Well, yeah, it's like in the microbiome is controlling, you know, your cravings. Yeah, absolutely. But, you know, I mean, I've tried before, but I guess I was sick enough and I hurt enough to say, okay, you know what? I can do this. And it's actually hasn't been that difficult because I was in pain, hurting, inflammation really high. In the process of changing doctors, I wasn't getting anywhere with one. So, I think sometimes we have to be a little bit more dependent upon ourselves to do the things we know can help our bodies, the water, the food, positive thoughts. Yeah.
Yeah, absolutely. Actually, if I can piggyback on the positive thoughts, I love cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing. There are all these different modalities, and where we can help train ourselves to think differently, right? We can begin our day with some gratitude. We can weave it into our lives. We can stop a thought if possible, etc. But to give ourselves grace around intrusive thoughts, because it's rare for me to find a Lyme patient who hasn't had some sort of intrusive thought process. And those thoughts are not me generated, right? I'm not, it's a thought that appears out of nowhere. That's not me sitting around thinking about being depressed or thinking about whatever that may say something terrible to me. And it's not hallucinating necessarily, it might be, but that capturing those thoughts and putting them away and being able to discern what's me and what's the germ, or what's me and what's inflammation or toxicity, is huge for healing. Because number one, if I can tell the difference, I'm better off. But number two, give myself grace. If I think something, that it may not be necessarily that I controlled the thought, but I can let that wash past me if at all possible.
Oh, I think that's so fantastic. Just let it wash. Yes, absolutely. And I recognize sometimes, when my thoughts should not be what they are. It's like, okay, come on, kind of giving myself a pep talk. Yeah. I think that's extremely important. And being ill, we like to control things, but the thought process, letting it wash over is just, I think that's just a very good analogy of how to, kind of get through. Okay, thank you.
Sure, absolutely. It's easy to get stuck on a thought, right? Something enters my brain, whether I sat around and thought about it or I'm driving and it appears out of nowhere, right? Like a little ghost that shows up, right? But it's easy to ruminate on that. I have a negative thought. Negative could be any number of things, or I have a scary thought about myself or somebody else, or a hallucination even that just pops out of nowhere. It's really easy to get stuck in the, oh, I can't believe I'm doing that. I can't believe I'm thinking that. Or maybe I should consider what this is really about, when oftentimes we're better off going, that was awful, and trying to put it away. It's easier said than done. But distinguishing is another something I spend a great deal of time working with people on, because it's not uncommon to have again, intrusive thoughts with Lyme, but being stuck there is a challenge. Those thoughts can be convincing.
Did you ever read the article called Swamp Boy? It's on the internet a few years back about an adolescent who got Bartonella down in Mexico.
No, I don't think I've read that.
Oh, okay. So this teenage boy went down to Mexico with the family, came back, and 6 months to a year later, told his mom, "I'm sorry, I have to kill myself because the voices are so loud, and I don't know if I'm gonna be able to keep saying no to them anymore."
Right.
And it took 2 years, and they found out he had Bartonella, and they treated, and he's fine. But yeah, boy, it'd be tough.
Does do all the co-infections, Bart and Babesia, do they all create mental issues?
What if I say they all have potential to, right? Because again, the confounding factors become a problem because if I have Bartonella and I have Lyme, it's difficult for me to say which one is causing what thought process. Babesia can help cause it, but I think what it boils down to is we have to eradicate the infections and we have to reduce your inflammation. So it's not a great answer, is it? But
No, yeah. How do
yeah.
you distinguish?
That,
one?
right. Yeah. Yeah.
Have you ever heard of NAC for reducing inflammation? What are your thoughts?
NAC, N-acetyl cysteine, right? Yep. Yes, I like it. In fact, it was in my notes and I didn't say it when I was rattling off all my stuff, right? Actually, NAC is great for inflammation and you have to watch for flushing. If you take NAC, you have to maybe build up your dosage slowly to see if you get flush and a warm kind of sensation. If that doesn't bother you, that's fine, but you want to watch it. But it's also more mainstream is an add-on for OCD. It helps with obsessive compulsive thoughts, which, so sorry, go back to intrusive thoughts, right? One, if not the same sometimes, yeah. NAC is pretty safe to take. You know, as anything, read up on it if you're going to add it. But that's a good one. I have a nurse practitioner on staff here and I have a supplement store. So I'm happy when people want to go at it from either direction or both directions, whether that's supplements or prescriptions, because again, what works. But yeah, NAC is one we actually have a hard time keeping on the shelf here.
Do you think NAC is better than glutathione, or so I believe NAC drives glutathione. I don't know if it drives anything else.
It drives glutathione, that said, it depends on what you tolerate better, right? So I don't, these are vague answers. I know it's hard to, because we're so individual and I read the research, but don't do the research. So I try to keep up, but glutathione is often a huge issue for Lyme patients anyway. And many mainstream physicians will even tell us to take things that will deplete glutathione. So then you got to supplement and, you know, but I mean, just personally, depending on what you tolerate, I'll just self-disclose, like I get a glutathione shot every week because I'm thinking it helps me with detox, it helps me with energy, it helps with cell damage, immune system, etc. Right? And so I'm like, I'll just probably take it till nobody will give it to me. But because that's easier, again, go back to what works. Instead of me taking NAC, for me personally, then just as an example, it's easier for me to go once a week, walk in the clinic that I go to, or like, oh, hey, just a second. They get the shot, they give it to me, I'm done. And it actually takes less than 5 minutes. And I just do that once a week and kind of have made it part of my routine. And so for a patient that will take NAC and finds it helpful, then that's best. And for somebody who takes glutathione orally and that's helpful, that's best. It's sort of figuring out what fits our schedules. Because I know myself well enough, and this is what I talk about with clients often, is what are you willing to do? What are you gonna do? And what are you gonna tolerate? And so that's just my example of, I don't know which is best. It's kind of what works for you, but do what works. And
Can't you do it yourself?
if you have to, but I don't know. I go
Oh.
to a local clinic there.
Is
Actually,
it functional or just a traditional?
it's actually it's a shot clinic, essentially. They don't give vaccinations. They do supplements and IVs. And well, now they're doing weight loss injections too, but they do shots for detox, and they do lipostat, and they do vitamin B12, they'll do methyl B12, they'll do a Myers cocktail, but they also do what they call their hangover cure, which a lot of these clinics will do, right? It's fluids. It's probably not going to hurt you either. But it's that kind of place where you go in, you get screened, and they go, okay, And it's cheaper than a bottle of supplements for me too, which also actually comes into play, doesn't it? Right? We talk about mental health, we talk about needing a Lyme doctor, but our finances actually to also take a toll on our mental health. And if I have to choose, I joke about this with my staff. If I have to choose my Lyme doctor or my therapist, I know I'm the first to go, right? Like they got a therapist not going to get paid for, because then I have to get well. But we also know that finances are a big deal. Most Lyme patients are broke. Maybe not broke, but watching those pennies because it's all so expensive and it's out of pocket. Except for maybe prescriptions, right? Yeah, I guess I wandered off on that question. Sorry about that. Watch me, rein me back in when you need me to come back on topic.
Do you have, are you in a network of, you said you go to the conferences and such. Is there a network of Lyme literate or tick-borne illness literate people like yourself?
Like therapists and counselors, etc. There is a loose network. I have a list that needs many of us who are therapists, a few of, there are not a lot of us anyway. We try to stay connected. Sadly, our easiest connection, I guess sadly is not really the right word, but we have a Facebook group and we try to add therapists who are Lyme literate there so that I can pop on and go, hey, you need somebody in Minnesota. Have you got anybody that can see somebody locally or who can take insurance? But that's about all we've got. Now I do go to ILADS. I'm an ILADS member. And that helps because I can also go to the membership and look and see if I can help you find somebody who might be a good fit. But you can do that too, right? You can go to a website. There are other websites that have databases of providers, but for Lyme literate therapists, there are few of us. And actually, of those, a lot of the Lyme literate therapists actually aren't really practicing in private practice.
Just like the docs.
Yeah. Yeah. So like I know of one who I think she seems great. She's out west and she works for the VA, which is fabulous. But then that makes her less available for others who might need her. And she's got her hands tied behind her back for what she can even say on the job, right? You gotta be careful. Yeah, but there's a loose network, and so if you guys need somebody, you're welcome to get in touch, and I'll see if I can help find somebody that's nearer to you or who maybe fits what you need. I'm always happy to help if I can. It's just they're so limited. Actually, recently I had a discussion with somebody just one-on-one, and they were saying we need more Lyme literate therapists, and the answer is yes, we need more Lyme literate everything. But what I think we need is also more Lyme literate people Lyme literate therapists in particular who accept insurance.
Yeah.
Because
That'd be novel.
Yeah, because like I accept insurance, but I can't do it outside Mississippi and Tennessee, right? So if you sign up to see me and you live in Kansas or Missouri or, then it has to be self-pay because of the insurance rules. And I get that. I follow the rules, want to be ethical, etc. But if I could connect you to a Lyme literate therapist near you who also took your insurance, that would solve a lot of problems. And I think therapists would be better able, we're in a better place to accept insurance and see Lyme patients than a doctor is because our overhead doesn't change. It's the same length of appointment, right? And that's just another thing. I'm begging therapists to get some training and learn. Just learn and listen. Yeah. I do sometimes help I help you figure out what to do to find a therapist near you who takes your insurance or who is more affordable for you, especially if you want to do something in person. And that's ask questions that help you figure out if this person's going to listen, right? Which might seem crazy because it's a therapist, but we come to things with our own preconceived notions, just like anybody else does, right? And if I don't understand Lyme and you're coming to see me and you're spending an inordinate amount of time explaining your illness to me or explaining why I'm having intrusive thoughts of self-harm, but I don't have a plan and I don't want to do it, then you're losing valuable therapeutic time educating somebody, when ideally the opposite is true. You find somebody, and if they don't know about what's going on with you, they're willing to do the research and learn and then ask you a few questions and focus on the issue at hand. And then another big one is if you can find a therapist who'll see you, who's willing to learn outside of just during your appointment time, who will also work with your Lyme doctor, even better. Because then we've got a better educated therapist who can better support you, that opens up more options for mental health support. You want to be safe, because I actually also, there are a lot of things I spend chunks of my time on. One of them is assuring Lyme patients that you can tell me that you're hallucinating and I am not going to ask you to go to the hospital. Or you can tell me that you had thoughts of harm, self or others, and I'm probably also not going to send you to the hospital. Because if you are in imminent danger, we got to talk, right? That's different. If you're in imminent danger, but what might send a mainstream patient to the hospital typically doesn't with me, because like we talked about, the thoughts come and go, and can we keep you safe, and do you have family support, etc. Because if you're a Lyme patient, you go to the hospital, they're just going to pull you off your Lyme treatment as well. So then you're headed backwards anyway. Yeah. But finding a local Lyme therapist is paramount, but yeah, it's finding the right person. Yeah. So I see a message about hallucinations. So if you'll oblige me, I use examples. It's just, I'm a storyteller, I think, anyway, but I do better at that than I do speaking. I have had several clients, well, many of my clients have had various hallucinations, right? Whether that's tactile, visual, auditory, olfactory, you name it. If there's a sense, we can hallucinate it. And one young man, he knows, I've talked about him, came to me with pretty severe paranoia and visual hallucinations, and has been doing Lyme treatment for 3 years now, and is very, very much headed toward robust health. I will also add that he has had an autism diagnosis, and that, though, even his symptoms of autism are improved because brain inflammation and other factors, right? But he and I are at the point now where we can joke about it, right? At first, we're not joking about that. It's scary, and it's differentiating what's real and what's not. But now if he looks off into the distance, I'll say, "Are you seeing something?" And he'll go, "Yeah, it's fine." Right? Just move on. Okay. Are we good? And he's like, "Yeah, it's fine. I'm just distracting." But he knows the difference, and it's not scary anymore. But my own daughter, who was the first in my family to be diagnosed with Lyme, had all kinds of hallucinations, bugs crawling on her skin, and hearing people call her name. And then actually, I will date myself, but I've told the story many times, and that's, I have an album collection, and had at one time multiple, mostly hard rock, but albums framed in my game room upstairs. And that's where my daughter spent the bulk of her time. And she texted me one day and said, "David Lee Roth is trying to kill me." I'm like, "Excuse me?" Right. So I don't know if you know who that is, lead singer Van Halen. But he had done a solo album, and has one of the album covers is him in tribal face paint. And it's silly and whatever, but to her it was terrifying. And she knew it wasn't real, but she needed me to come take that off the wall. And that's it's some of the things that I try to help normalize with Lyme patients is, yeah, it's awful, but let's be practical and let's look at what's real and what's not real and how do you manage that, right?
Yeah, the day that I had the hallucinations was probably the worst day of my, well, one of the worst days of my life. I'm 46 now, and that was when I was 12. Probably one of the earliest kids diagnosed in the Kansas City metro area.
Yeah.
But I walked into my school at the time and did not even know where my classroom or locker was. I ended up just sitting into a classroom, and the teacher directed me to the nurse's office, which I couldn't find, and was right next to the main office. So I finally made it to the nurse's office, and I was laying down, and there were holes in the ceiling. And I was laying down looking at those holes. And by the time my dad got there, those holes were moving around the ceiling. And I asked my dad if he could see those holes moving around the ceiling or if it was just me. So no, Jay, it's just you, and I'm going to get you help. And he picked me up, and then my brother was at a different school, also experiencing issues, and went to the nurse's office and picked him up as well, and took us both to the emergency room, asking for us to receive some type of treatment. And the pediatrician at the time was a non-believer and was explaining how we were experiencing psychosomatic problems, and that we did not have Lyme disease. Needless to say, we sought another doctor after that. And then years later, his wife ended up coming down with Lyme disease. So he became a believer and quit the practice.
How about that? How about that? Thank goodness you had a dad that was taking you seriously as
Well,
well. And
yeah, we all, my brother and I, my mother and I, or my mother and my dad, we did a trip to Arkansas, the fall of 1990. And by Christmas, we were all experiencing it, experiencing the same thing. And he didn't tell us everything he was experiencing, so he knew it wasn't psychosomatic.
yeah, yeah. I get frustrated about a lot of things just because, when in the Lyme world, we're kind of swimming upstream anyway, often, but one of them is the idea of psychosomatic symptoms, because I wonder how much of what gets labeled as psychosomatic
Yeah,
is really your body is malfunctioning, but because somebody doesn't have another explanation, they're like, oh, well, your brain talked you into that. Well, maybe not, right?
yeah. And afterwards, he told me, Jay, I'll get to the end of the driveway and not know if I need to turn left or turn right. And I've been working at the same place for 30 years.
Yeah, absolutely. So, the
Yeah,
directional issues are pretty common. I don't know if how many of
yeah,
you have experienced that, but my poor daughter, she's a poster child and her ears are burning, but she was a teenager and was going to drive to her best friend's house, which by the way was maybe it's like a mile and a half away. And she pulled out the back of our neighborhood and didn't know where to go. Couldn't remember where to go. I had to come get her. And it happens to us at all kinds of ages. Yeah, it's scary. Just the brain fog and the memory issues. And that leads to what we now also understand is that many forms of dementia may be infection and toxicities that can be mediated at least, if not fixed. Just getting somebody to test and believe you. But to me, that's a hopeful thing, right? Like to know that if I start showing signs of this or that somebody can take me, if I can't take myself, to a provider that can help make things better. The frustrating part is watching it happen and feeling helpless if it's somebody around you where you may be aware that there can be infections, but you can't get them into treatment.
yeah. I have a few friends that have tested positive, and I tried to get to join this meeting, and I told them that I would been there, done that, and I'll join it with you or for you and let you know.
Yeah, yeah. Yeah. So, that the dementia thought, and I acknowledge that I tend to wander, I chase rabbits, right? But that we see dementia run in families, right? And we're taught that, and as mental health professionals, we look at other diagnoses, bipolar disorder, schizophrenia, any kind of mental health diagnosis runs in families. But I think maybe a better question versus who else had it, maybe dad, mom, grandmother, aunt, uncle, whatever. Better question is who's got infections, right? And are there genetic factors that predispose you to that? Not me saying that there are there are not other ways. There are other ways to end up with mental health diagnoses and dementia, but case in point, in my own family, there are a few diagnoses that run in the family. But now that I know what I know, I want everybody to get tested and let's find out if it's maybe just infection. It's bigger than just infection, but if it can be fixed, because we're also stomping around in the same woods, right? And we're going to the same ball fields or the same family vacation, right, Jason, that where we may be exposed to the same things, and it plays out differently in different family members because of genetics. You may be familiar with the expression that genetics load the gun and environment pulls the trigger.
Hmm.
You heard that one? No? Yeah, it makes a lot of sense because it's where well, of my three kids, my oldest and middle children, two daughters, same environment for the most part, same a lot of things, but the younger daughter got severely ill. And they were, again, both daughters tested positive. Both daughters tested positive for almost all the same things. But the big difference was genetics, and MTHFR mutation was one of them. But the other one is their exposure to trauma. So then we add to the mental health discussion, not just infection and going to the same places and genetics, but if we're both experiencing similar trauma, but it plays out differently, what's the difference? And it's not necessarily coping skills. It might be different infections. It might be different genetic abnormalities. Anomalies is probably a better way to put it, right? There's just so many factors that when we talk mental health and Lyme, it is probably impossible to pull it all apart. What is possible is to know that there's a cause for this stuff and it can be managed, and then with proper treatment, may be gone.
So my practitioner had a story that when you talk about running in families, he has 4 children, and the first 3 developed Lyme between the ages of 2 and 4, and they decided to check his wife, and it turns out that she had Lyme with no symptoms. And so with the 4th kid, when she was pregnant, they treated her with antibiotics, and that child was born seemingly without Lyme. So um, it can come through the family in multiple ways. Another kind of curious thing: at least 2 of the 3 kids who had Lyme also went on to develop ADHD and such. So there was,
Yeah.
yeah.
Yeah, absolutely. Absolutely. Well, that said, we, meaning my providers and my kids' providers, and I am pretty sure I gave it to all 3 of my kids. They developed, it's just the middle child that got sick first and was the sickest, experienced some different things and was at a different age when those things happen. And we know that trauma suppresses your immune system. Well, that's a factor as well, right? Our bodies react, suppress the immune system, allow the germs to emerge, allow the inflammation to get bigger. That leads to more mental health problems, right? But yeah, we're pretty sure I gave it all 3 of my kids. And that, again, probably more common than we know, right? I didn't know I had Lyme. I will say, I do know that after the birth of my first child, I crashed bad. Like it was bad. I could barely move, and postpartum depression, but also just, I won't bore you with the whole story, but eventually to move in with my parents for them to help me when I was married, because my husband was working, for my mother to be able to help me take care of my newborn. And it took months to get a semi-diagnosis. What I really got was a list of multiple diagnoses that we now know are probably Lyme, right? But she wasn't terribly sick. However, she didn't sleep. And people will say, well, newborns, no, newborns sleep. This one didn't sleep. And looking back, I wonder what else we didn't know, right? But then my second child, when she was born, I didn't crash so badly, but she was terribly sick. And there's a list. It's actually put out by the Gym Sec Specialty Clinic, which is no more, but it's a pretty good list of signs and symptoms of Lyme and co-infections in pediatrics. And my kids, especially that second one, had everything on the list. But we didn't know, right? Pediatricians don't look for it usually. Nobody looks for it. That's not fair. Few people look for it, right? Yeah. Yep. So actually, I will also say something that comes to mind is neuro Lyme, right? I sometimes get questions about whether or not chronic Lyme is neurological Lyme, and the answer is most of the time yes, right? Because it disseminates and it enters the bloodstream. It can even get in our bone marrow, but it can definitely get into our spinal fluid. And then even if you don't have mental health symptoms, but you do have pain and twitching and numbness, etc., that's still neurological Lyme because it's in your neurological system. Yeah.
Does you mentioned this MTHFR, does that lead to mental illness or?
Well, like anything, it has potential to. Sorry, it will depend on if you're heterozygous or homozygous for a mutation. If you have one or two, right? So I don't want to get, neck deep and not describing it well. So I don't want to, but there's A1298C and C677T are the two mutations. And you can have two of one or one of each, or one of one or the other. And depending on who you ask, they'll say that one doesn't matter or two matter a lot. But the combination is definitely not great. And I suddenly don't remember which is, but a double copy of one or the other will lead you to be more likely to develop early heart disease and just generally cardiovascular issues. But then another is more likely to lead to chronic mental health conditions. But both, think about it, really both are inflammatory. That's the problem. You end up with high homocysteine levels, etc. It's worth getting tested, but that's also one that you can maybe, with a doctor's care, play with a little bit with your in the supplementation of methyl B12 and methylfolate. And again, not medical advice. Definitely check with a provider who can explain it more clearly than I did. But we actually, I have known of psychiatrists, mainstream psychiatrists, prescribing something called Deplin for probably 20 years. I'm sure been around longer than that. And it used to be prescribed as a last resort for people who had chronic, difficult to treat depression. Deplin is methylfolate and methyl B12. You can buy it and your insurance covers it if you get a prescription. Nobody asked why that happened, but yeah. Before I knew about Lyme, I knew about Deplin and didn't understand it well. And now I think, well, they were onto something. Maybe they just still don't know quite what.
But they only want to give it if nothing else works. Why aren't you
Yes.
leading with that?
Right, yeah. Absolutely. Yep, would be nice. But they're trained to lead with other things, and there's always a new med, which may work, which is fabulous, but yeah, they're not trained to usually, they don't usually go to the old stuff, do they? That's broad category, but no. Yeah. So let's see, I'm gonna check my notes. What have you guys got? Anything else?
Are there any other diseases that are as complicated as Lyme disease? It strikes me that to treat Lyme disease, you have to be, as a doctor, very brilliant. And I think a lot of doctors just don't want to put in the effort because it's so complex and so demanding.
It is demanding, and that's, I have heard more times than I can count the complaint that Lyme doctors don't accept insurance. And the reality is it's difficult to not, if they're worried about licensing, et cetera, let's put that aside and just talk about the complexity of the disease and the time it takes to effectively treat a patient. My insurance pays my doctor for 15 minutes, if you will. I'm a Lyme patient. I'm going to need an hour. And it's difficult to keep a clinic doors open otherwise, because yes, it's complex. And a lot of doctors, and on the one hand, I don't fault people because this is what they're trained to do. And that's see the patient, listen to the symptoms, give them a prescription, or send them for testing. I get that that's the mindset, right? And it does take a significant amount of time and brain power to really parse out what's wrong with somebody, where the causes are. Lyme is hard to treat. And we're all different, right? It's also not like you can just give somebody a protocol and it fixes everybody because too many factors. It's not like if I get a sinus infection, which also actually, have you ever thought about with a sinus infection, several factors? One of them is nobody ever tells you really, well, nobody, but you're not frequently told what the infection is. What do I have? And it's awfully close to your brain. So is that affecting my mental health as well? And is there a colonization of fungus, or is there chronic inflammation, et cetera? So I have, anyway, but they'll give you a Z-Pack, right? If you have a sinus infection, they'll give you a sinus cocktail and send you on your way. And Lyme's not like that.
Same with the ears. That's pretty close to the brain.
Absolutely. Absolutely. Tonsils, all that gets inflamed, which actually leads us to like PANS and PANDAS, right? Increasing number of kids that I see, it's easier for me to really work with the families than it is to just work with a child with PANS and PANDAS because they're having enough difficulty like it is. We can give them some coping skills, but helping the family manage the child's illness is often a better solution. But yeah, strep gets in the bloodstream, but you get a sore throat and you get an ear infection or you get a whatever, and boom, you've got psychiatric symptoms. Adults do the same thing. We just don't have a catchy name for it. Like PANS and PANDAS. Yeah. I'm like a toddler at the doctor's office. The 3-year-olds always go, why? If I go to see a provider, but why? You have this happen, why? Why do I have whatever? So, can be annoying for them, but I don't know, I encourage it. Why do I have this new diagnosis? Run it by my Lyme doctor, but any physician, keep asking what, maybe we'll prompt somebody else to think more about why if they haven't stopped, if we keep annoying them. Yeah.
Or they put crazy right on your chart, every time you walk in.
Right? And then you're dismissed. I can't tell you how many people I have loosely, if you will, diagnosed or at least identified potential Lyme because they were dismissed by multiple doctors or repeatedly dismissed by the same doctor who said, you need therapy. Yes, you probably do, but also you're not crazy. You're sick and your doctor doesn't know what to do with you. So they label you, but I've had many a discussion about, oh, well, I need to bring up something else. I've lost clients over it and I'm okay with that. I don't push it on them and it's not usually the first appointment, but if somebody comes in and they've got that kind of story where they were labeled and the doctor says, oh, you're psychosomatic, you need therapy, I start asking if they'll talk to me about the possibility of things they might not know about in Lyme and co-infections. And at this point, I'm not batting 1,000, but of the people that I've had, that I've brought it up to who were willing to get tested, I am at 100%. It's that prevalent. It's not me, it's just that it's that prevalent. Yeah.
I think we're all Lyme experts too. I bet we could come up with maybe not that high, but pretty high percentage of recognizing it and
Oh, probably. And it's one of those things you can't unsee, right? Once you see it in yourself and you know others, like as in these kinds of settings, and then you go somewhere else and you hear people talking or you watch something happen and I don't know about you, I have to watch myself because I'm thinking, oh, my person got Lyme, right? In what context can you bring it up?
Yeah.
Can't unsee it. Yeah. Yeah. Absolutely. Actually, remember a time I was at an event and a young woman standing in front of me had on shorts and she had Bartonella stria all over the back of her legs. And it was all I could do, right? Not to go, can we talk? I was a stranger. I couldn't do it, but it's, yeah, one of those things we can't unsee. You could probably all pick it out in people. You know. So.
Well, I think we've come to our little after 8 o'clock. I
Yeah.
think our time's up unless somebody have an urgent last question they want to get in, or I think we're good. Leslie, do you want to say goodnight?
Sure, I would be happy to. First, I just want to say, Julie, thank you so much for all this wonderful information. It's so helpful. And, even though with Lyme, everyone has their own journey, it's quite often different, but there's so many similarities between everyone as well, going through that journey. So I just want to say thank you so much for sharing your knowledge with us this evening. I appreciate it.
Thank you. Thank you. You're very welcome. You're very welcome.
Okay. I'm assuming no one has any further questions or anything. So if that's the case, we could probably call it an evening.
Thank you, Julie.
Okay.
Thank you. Thanks
Thank
for
you.
having me. Thank you for having me. It's nice to see you guys.